Hello, and welcome to the Clinical Liver Diseases video series. CLD is an official digital learning publication of the AASLD. My name is Dana Lai, and I'm a gastroenterology and hepatology fellow at the University of Wisconsin in Madison. And this is Jessica Musto, assistant professor of medicine in the Division of Gastroenterology and Hepatology at the University of Wisconsin in Madison. Today, we'll be discussing our article recently published in CLD called Immunizations in Liver Transplant Candidates. In this article, we discuss vaccine recommendations for liver transplant candidates and recipients, which is important given that they're at increased risk for infection.
Candidates for liver transplant should ideally get as many recommended vaccines as possible before they are transplanted, since vaccine immunologic responses are typically higher pre-transplant. They should also be given as early as possible during the course of liver disease. If patients cannot be vaccinated pre-transplant, inactivated vaccines are also safe after liver transplant.
Ideally, any live vaccine, including MMR and varicella, is given pre-transplant. If able, completing an activated vaccine series 2 weeks before a liver transplant and live vaccine series 4 weeks before liver transplant is recommended.
Some of the vaccines we discuss and recommend include the influenza vaccine, but only the inactivated form should be given to liver transplant recipients. Hepatitis A and B vaccination is also recommended, given that patients with chronic liver disease are at increased risk of severe complications, including fulminant hepatitis and death. Pneumococcal vaccination is also recommended to liver transplant recipients, given that they are at greater risk of invasive pneumococcal disease. There's a high incidence of herpes zoster among liver transplant recipients, especially those who are older or taking mycophenolate. So this shingles vaccine is also recommended. The HPV, or human papillomavirus vaccine, can be considered for immunosuppressed patients based on their age, as there is an increased risk of HPV-associated cancers in solid organ transplant recipients. Finally, the COVID vaccine, including boosters, is recommended for all adults with chronic liver disease and liver transplant recipients, regardless of prior infections, because patients with comorbidities are at increased risk of severe infection.
We wrote this article because improved adherence to vaccine recommendations in this patient population can help to improve morbidity and mortality related to infections that are vaccine preventable.
Providers can help by obtaining thorough vaccination histories, counseling on vaccine recommendations, and giving necessary vaccines to their patients with liver disease. It's important that providers who care for these patients stay up to date and informed on these vaccine recommendations. On behalf of all of us on the CLD team, I hope you found this short video on recommended immunizations in liver transplant recipients useful. For more information on this topic, please visit us at www.cldlearning.com. Thank you for watching.